If you're like most folks Dr. Kris Fusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris podcast. Welcome back. It's the Dr. Kris Life podcast with our favorite doctor who likes to, will actually answer your questions and not make you feel bad for answering questions about what you care about as a patient, looking for a provider that wants to pair up with you, that you want to have responsibility in this deal. That's our man, Dr. Kris. Dr. Kris, how are you?
I'm good. How are you today, Steve?
I'm well. I'm great. Thanks for asking.
Good.
Holidays are coming here, and folks are, I do a podcast with one of my clients, and he's a behavioral scientist. And one of the things he talks about, there are these places in our life that we reorient and start to think about certain things every year. And one of them are the first of the year. It's when we start to evaluate what's going on in our lives, what we want to improve. It's just kind of the way that we're set up. And so when we think about some of the things that our folks want to do, hormones come into play on this conversation. When you think about wanting to lose weight, maybe get in shape, want to feel better, these things, bioidentical hormones are a part of a conversation that they should consider. Wrong?
No, absolutely correct. We always talk about in our practice, we'll get a lot of patients that come in and maybe they want to lose weight. That's why they walked in the door, and they're like, and they know that we do a weight loss program. And, you and I have talked quite a bit about that. But I'm like, hey, we can't skip to that. That's too far down the road. The analogy I always use in my office is we don't want to build your house on sand. We got to lay that foundation. We have to make sure that we have all the basics in check so that we are basically having the body fight for us versus against us. And hormonal imbalance is something that is overlooked by most patients and providers, and is just seen as something that naturally occurs and we just have to deal with it, which is absolutely not true. And then the other myth, maybe you want to put under that category that's out there, is that all hormone replacement is the same. And that's simply not true as well. Animal-based or synthetic hormones versus bioidentical hormones are dramatically different. And, I always tell my patients how it only comes back this morning because I was looking at my reboarding, because I'm like 3 years away from reboarding. And I was like, crap, I guess I better start looking at that process and what do I got to do? Because it's about a 3-year slow process to do all of that. It's, nothing major. It's just always a little something you got to do. And it brings back a story. And that is the last time I reboarded, which is every 7-8 years, I had to answer a question incorrectly in order to get the question right. And because I knew what they wanted, and what it was is it says estrogen replacement increases the risk of what? And I had to check breast cancer and heart disease, which is bullshit. Actually that study's been debunked, but, bioidentical hormone replacements have been absolutely shown to do the opposite. But I also knew the writers of the question and what they wanted as the answer. So even though I disagreed, I answered the question as you're supposed to get the question right. But it's that still even today, after studies that have been out 15 to 20 years, that basically have been debunked, there are still providers out there, and especially patients, that don't understand the safety of bioidentical hormone replacement.
So bioidentical hormones, I found a list of these benefits from bioidentical hormones. And so I wanted to kind of go over each one of those and get your feedback on these. But first, I wanted to just let's define bioidentical hormones. And this here says there are synthetic hormones that are structurally identical to the hormones naturally produced by the human body. Would you agree with that statement?
I would not. And the reason I disagree is I use the word synthetic. They're not synthetic, they're natural. And so that's actually goes against what bioidentical hormone replacement is. They were right after that, but they're not synthetic. They're actually plant-based hormones that are 100%, so they're all natural. They're not made in a lab. They're 100% identical to what is in your body. Okay. So, basically I always tell patients the name really says it all. Bioidentical hormone replacement, bio meaning natural, identical meaning identical, hormone replacement. And so I have a slide that I sometimes show to providers when I'm lecturing to providers, doctors, NPs, and PAs. And that is, I'll show testosterone, and I'll show bioidentical testosterone, human testosterone, and synthetic testosterone. And of course, the bioidentical testosterone compound, along with the human testosterone compound, what we have in our body naturally, is exactly the same. And then you show testosterone cypionate, and it does not take a doctor or a scientist to be able to see very quickly how those chemical compounds are not remotely the same.
Wow.
And you can theorize, as I always tell my patients, that if something is, I think this isn't too much of a stretch, that if we're putting something into our body that's 100% exactly like what's already in our body, we're going to have less chance of side effects and issues versus something that is not identical to what's in our body. I always try to tell people, I'm not trying to make this difficult. Let's just think of it very simply. I'm putting something into my body that is 100% either been in my body before or is already in my body. All I'm doing is optimizing levels.
Excellent. So I like this. So we're going to read out this list, and then you continue to either agree, change, or whatever. But this is excellent. Now, this list, what are potential benefits? Some potential benefits of bioidentical hormones for women. But the first thing I want to cover is these aren't just for women. Men take advantage of this as well, right?
Correct. Yeah, absolutely. So it's advantages. The list is probably geared towards females and maybe the estrogen replacement, but absolutely men and women get very similar results from estrogen, from bioidentical hormone replacement. Excuse me.
I saw this post. Anyway, they were saying toxic testosterone in men and I was just giggling because I learned from you that actually women have testosterone and as well. I guess it's just not toxic.
And men have estrogen. That's what I always tell my new guys is like, hey, you've got estrogen, your wife has testosterone. We're just not supposed to have the same amounts.
Mm-hmm. Yeah. All right. That's funny. Okay. So number one, this can help relieve menopausal syndromes.
Yeah, and that's the lowest hanging of the fruit, I'm sure, on the list, right? So, they're talking about hot flashes, vaginal dryness, maybe a little brain fog, and that's always going to be, not always, but that's usually going to be the main reason why the patient walked in the door is, hey, doc, please make these we're lucky enough we'll never go through hot flashes. We're lucky that we're not going to have to do that. But any woman that's ever been through it will tell you how severe it is. And I've told the story on this podcast before, but Crisanta, my wife, who was 50, on her 48th birthday, I came in from outside and she had her head in the freezer. And I was like, what in the hell are you doing? And she's like, I think I literally just had my first hot flash. And, I thought, she's being dramatic. Sure enough, drew her blood the next day. She was menopausal. So the average age is 48 to 52. So, I mean, she literally nailed that. And she would basically tell us how bad those are. So sure, if we, as I always tell patients, getting rid of hot flashes is extremely important. Vaginal health, when a lady has vaginal dryness, not only are they more susceptible to UTI, urinary tract infections? They're also, their sex life is impaired, that normal moisture that's there is not, and it makes sex not as enjoyable. It'll kill their libido, make them more, like I said, more likely to get infections, just kind of make life miserable for them. And so, yeah, couldn't agree more on the statement that it helps eliminate those menopausal symptoms.
Yeah, you were talking, I remember sometimes I've gotten sick. I was about to throw up, but I had this big crash of sweat, and it's really unnerving. It knocks you off balance. And I
Yeah.
can't imagine that experiencing that on a regular basis.
Yeah, especially multiple times a day.
Yeah. Okay. Improve sleep.
Yeah, again, this is kind of the general concepts that I always tell patients is that the first things is hopefully the hot flashes are going to go away. Hopefully you're going to start to notice your sleep improving, because we know that the vast majority of us, as we age, naturally start to see sleep decline. And what does that mean? If you wear, and I'm a big fan of sleep monitoring devices. Actually, right before we started, I stuck my Oura Ring on the charger because I'm a huge fan of Oura Ring, but there's a plethora of sleep monitoring devices. But if you really use a sleep monitoring device, at least a fairly accurate one, you'll most of the time see that without intervention, our sleep cycles start to worsen and we start to get less REM sleep and deep sleep. So that restorative sleep, we awaken more. And a lot of that age, but a lot of that can be attributed towards a hormonal imbalance. And so it's one of those things that my patients who do wear sleep monitoring devices, I'll implore them to actually keep track of that so that they can actually see their sleep improving. Because it's hard just to subjectively say our sleep is improving. Oh, yeah, I think I'm sleeping better. Well, that's great, but I love objective data like the sleep monitoring devices, and we'll absolutely see that deep sleep, REM sleep starting to increase and less interruptions at night. And that doesn't even go down the path of like sleep apnea, because if we've let ourselves get overweight because our hormones are imbalanced, which that may be on your list, weight gain, but we can lose weight if we balance our hormones, which if we lose weight and we don't have as much sleep apnea, that's going to help our sleep as well. So it can help it in a multitude of ways.
Yeah, this says reducing night sweats as well. So
yeah, just feeling better, right? So these poor ladies, and I would throw thyroid into that as well. But monitoring and managing the thyroid as well, you're just going to have these patients have less hot and cold intolerance, so that they just sleep better.
All right. Increase sex drive. Bioidentical hormones can help to increase sex drive, which can improve sexual satisfaction and intimacy.
Yeah, and again, this obviously is for men and women, but again, specifically physiologically, if a lady has vaginal dryness, it's pretty rare that she has a great libido just because sex isn't comfortable. So again, restoring that vaginal flora is going to be very important for overall libido. But then just, some ladies come in and they're menopausal, but they don't have vaginal dryness. Not every female does, but they'll start to notice that kind of internal libido starting to come back, because it's just kind of common. I'm not going to say it's normal, but I want to say it's common for men and women, actually, not just women, to start seeing their libido dip off. And actually, I don't know if you've ever seen this show. We were watching it last night, called White Lotus on HBO. We just started watching it, and it's like the third episode, and this guy's been married to this girl, and he's like, you've been married to her for 22 years, and you look at her and it just looks like a bowl of worms. You don't want to have anything to do with her. And I was like, God, I hope that's not, thank God that's not real. But I think a lot of people, as they get older, they start to lose their intimacy with their mate, their significant other. And as I always try to tell my patients, sex isn't a dirty word in our office. And also, I truly, truly believe intimacy is crucial for healthy relationships as we age. And I don't know about you, but I don't want to give that up, and hopefully ever, but damn sure no time soon at 50 years old.
Yeah, exactly. All right. This one says improved mood. Bioidentical hormones can help to improve mood and reduce symptoms of depression and anxiety. True or false?
True. And they're actually the stats, actually the company I work with, BioT, actually followed these stats for hundreds of thousands of replacement pellets. And they actually found that 66% of patients who suffer from some form of anxiety and or depression, 66% of those patients that went from hormonal imbalance to balance saw some to significant improvement in their depression, anxiety. So I always try to tell patients, I'm not saying it's necessarily going to fix your depression, anxiety, but I always try to dig a little bit deeper. And if a patient tells me, hey, I'm 50, I've been depressed off and on since I was 15. Well, that patient may truly be biochemically different and probably is going to suffer with depression, anxiety their whole life. But you'll be surprised how many people you talk to and like, wow, I've never really had depression, anxiety till the last couple of years. And I don't really have any reasons for it. I haven't had any trauma, any recent trauma. My marriage is stable. I'm financially sound. And those are the ones I find a high rate, notice dramatic improvements in their mood. And we do symptom checklists quite frequently with our patients. So before we start hormone replacement, when they come back for their visits, we do these symptom checklists, or even if a person says, I don't think it's working for me, we'll have them do a symptom checklist, because you'll never remember the answer to those 20 questions that you did 6 months ago, what you put, and it's funny because 8 out of 9 out of 10 times, they'll be significantly better on their symptom checklist, even though they don't think they feel better. And that always makes the patient at ease when they can see, oh, I guess I was a lot worse off, because sometimes they're just unrealistic expectations. But absolutely, maintaining hormonal balance has a very good chance of helping depression and anxiety.
I think oftentimes maybe they wouldn't admitted they were depressed, or but they would say, yeah, people say I'm grumpy or more grumpy, but I think sometimes they're depressed and don't know it.
Yeah, and it's hard to admit that, right? I think sometimes they know it, but it's hard to admit it. It's kind of admitting a weakness, but that's okay. And then, like I said, sometimes we just get so used to how we feel that we don't know anything different. I've had some patients look at their labs and they're horrific, and because their spouse drug them up here or something like that, and they're like, well, I don't know why I'm here. I feel great. And I'm like, Jesus, you shouldn't feel great with these labs. And then you go ahead and correct some of those things. And then they're like, oh, I guess I didn't feel as good as I thought I did. Because we can get very used to how we feel, good and bad. Sometimes when you feel bad and then you feel really good and then you get used to feeling good, you think you don't feel good. I mean, it's just one of those things that we have to make sure and just keep on top of it.
All right. Next is increased bone density. Bioidentical hormones can help to increase bone density, which can reduce the risk of osteoporosis and fractures.
Yeah, this is actually one of my favorites. And so this is a very under discussed topic. So osteopenia, the loss of muscle mass, bone density, osteoporosis, the actual disease of thin bones that make you very, very likely to fall and fracture. And we know that when we get into geriatric status, that if we fall and break a hip or have a major fracture, the chance of death, or at least a major change in the function of how we live out our life, is dramatic. And I think everybody who's probably listening who's over 40 has been affected some way by somebody who fell and fractured and their life was never the same, or they died. And so bone density is extremely important. The main way bone density is treated in America right now is a class of medications called bisphosphonates. And the bisphosphonates are not an optimal class of medications. They do have some significant GI side effects. And guess what increases bone density better than bisphosphonates? You already probably know the answer.
Bioidentical hormones.
Yes, actually, testosterone and estrogen combined actually are better bone builders than bisphosphonates. So we can give the patient something that has little to no side effects, actually all pretty much positive effects. The side effects are minimal and we can manage if a patient even has them. But yet every day, thousands of scripts of these bisphosphonates are written. It's just one of my pet peeves that we could be treating these patients naturally for their bone loss, or even better, getting Betsy before she becomes thin on bone, putting her on hormone replacement, and then hopefully she never has to worry about that problem down the road. Because most of these patients, why are they actually getting osteopenic or porotic and penic and then porotic? loss of muscle mass, as we've always talked about. It goes back to sarcopenia. So it starts at sarcopenia, the loss of muscle mass. Then we deteriorate to thinning bones, to actually pathologically thin bones, osteoporosis. And then at that point, it's very hard to back out of that situation. As I tell patients, we're really stabilizing and trying to prevent worsening. But we can improve it. I'm not saying we can't, but it's difficult. Where we do our best is where we prevent Betsy from ever going down that path.
Wow. And then again, this is something that your body produces itself. For whatever reason, it's not producing it like it used to. And I like to think about this is just sending an email to that part of the body to just produce more of this. I'm thinking of that as peptides, but this in a way is
Similar. We're just replacing, though, in this situation, we're actually just replacing it, unlike a peptide, but we are replacing something that was already in the body. Its levels have naturally dipped. I think that's a good question of why do my hormones deplete? Well, unfortunately, when we were kind of created, we were only meant to live about 50, 55 years. Okay. And then I also believe that the stress that we're under, constant contact, I call it, and not the email server, whatever you call it, but the fact that we never can check out of life, we're constantly stressing our bodies. And then the food that we eat, you will not be able to convince me that we now can produce a chicken, from birth to death. We've half the time, and we've made them twice as big with steroids, but yet we're told that doesn't affect us in any way. And even though you can try to do really good at home and, eat, good, clean foods, most of us are still going through drive-throughs and restaurants, and, the quality goes out the window with that. And so I believe all of those things come together as to why we're depleting on hormones so early now. Oh, and also take out the fact that for most of us, we're not labor-driven humans anymore. Used to, maybe Bill ate poorly, but he actually went and worked out in the field all day, and he came in and he ate, chicken fried steak, but it was meat that was produced on his property, and vegetables that were grown in the ground, and all of these different substances weren't used on them. And plus he burned off all of those calories after a hard day's work in the field.
Wow. Okay, here's the next one. Improved cognitive function. Bioidentical hormones can help to improve cognitive function, including memory and concentration. I'm reminded of Crescenta's kind of her testimony of going on this.
Yeah, again, we always talk about things that help with bioidentical hormone replacement like today, but long term, we also know that our estrogen deficient females, in other words, menopausal females who've not replaced their estrogen, are at a significantly higher risk of dementia, Alzheimer's disease as they age. So estrogen has somewhat of a neuroprotective effect on the brain, as well as other peptides. And so we know that when females are just like, it's fine, I'm just, my hot flashes went away after a couple of years, I'm okay, I don't care if I have sex anymore. Well, it's not just that, it's also our cognitive function that is really negatively affected by the lack of hormones. And so short-term patients will usually say that they feel like the brain fog is lifted and they're actually thinking more clearly, but long-term, we're lowering the risk of dementia.
Wow, that's huge. Several people in my family have struggled with that, and it's so hard on not just the victim, but the folks that take care of them.
Yeah, it's going to be a major focus for research in 2023 is really, with all the new data and all the new testing that we have and the new treatment protocols that we have now for high risk patients for dementia, that we can now we can find and we can actually, test them and figure out very early that they're very high risk, that we can actually intervene with those patients before they get down the road, because we simply know that 40% of Alzheimer's disease is in our hands. This thought, and it's absolutely a thought with most Americans, is that, well, if I'm going to get dementia, I'm going to get it, and it just is what it is, and I don't want to know about it. Well, there's 40% of that's actually in your hands, and there's proven facts that, you can have two identical twins that obviously are the same genetically, and one, they live the same length of time. One develops dementia, one does not. Well, that proves that, there has to be something more than just genetics playing a role in this.
Wow. All right. Next on the list, reduced risk of heart disease. Bioidentical hormones can help to reduce the risk of heart disease, which is a major cause of death in women.
So another one of the probably most common myths that we have to dispel when it comes to bioidentical hormone replacement, specifically testosterone replacement, and that is that testosterone is bad for the heart. And so that's, again, I still hear that the most from providers, and I hear that the most from patients. Either they've read it or their provider at some point has told them, well, be careful of that testosterone, it's going to give you a heart attack, and I was just out at, I say just, now it's been about 3 months since Peptide World Congress, and we have an amazing faculty member, Abid Hussein, who's a concierge cardiologist up in Denver, and he did a whole couple of slides on the safety of testosterone and how they're really, how it's nothing but positive for the heart. All of that old stuff that's been floating around has been dispelled. All the studies are clear that testosterone is safe for the heart and actually improves heart function, doesn't actually hurt heart function. Now, sure, just like I always joke, just like water, we can actually drink too much water. We can get water intoxicated. It's really hard to do, but you can. We can take way too much of testosterone and we can harm the heart. And when you hear of these things with guys, we got congestive heart failure and things like that, these are people who are abusing it, and that's what I always say is nearly everything in our life has safe levels that we can do of it and unsafe levels that we can do of it. My car, if I'm driving at speed limit down the road, chances are I'll be okay, although something could happen. But if I'm going 180 down the road, well, I'm raising my risks of a negative outcome. And so, these things that you hear about testosterone in the heart in a negative way are related to people abusing testosterone, which is not what we're advocating in any form or fashion.
So when we're mentioning these bioidentical hormones, generally these are little pellets that you put under the skin.
Yeah, that's typically how we do it. We're a majority of our patients are pellet patients, and so we place bioidentical hormone pellets under the skin. But you can also do it in gels, creams is the other way to do bioidentical testosterone. Testosterone shots are not bioidentical. I always just try to make sure patients understand that. There can be some positives and negatives with injections, but they are synthetic testosterone.
All right. Excellent. Here's the next. Reduce risk of diabetes. This was a surprise for me, but I think about it. Why would it? Bioidentical hormones can help reduce risk of type 2 diabetes, which is a common health problem in women.
Yeah, pretty simple. You just have to look at it from the overall view, right? Hormonal balance is going to improve cellular function, just like some of our peptides do. We're going to be able to maintain weight better. We know that becoming overweight is a major reason why we become insulin resistant. Insulin resistant turns into diabetes. And so anytime we're improving overall function, cellular function, just how the body does, I always tell patients, I was the first hormone replacement patient into practice because I was patient number one, and I was very overweight, and it wasn't just bioidentical hormone replacement that fixed me, but it was probably 60-70%. Then when I combined that with a proper diet and a new exercise program, I lost dramatic weight. My insulin resistance went away, and I haven't seen it again in 16 years, because everything is operating well. So yeah, absolutely. We can, when I get patients in here that are insulin resistant, I always tell them we need to first balance your hormones, and then we might need to add on like maybe a semaglutide or something like that specifically treats insulin resistance. But if we use a semaglutide without the hormonal balance, we're not going to get the same results. So this is really a 2 + 2 kind of equals 6 scenario, that we need to make sure that we balance those hormones so we're able to get that synergistic effect together with other peptides.
Cool. Here's another one. Improve skin health. There's 2 more here. So improve skin health. Bioidentical hormones can improve the health and appearance of skin, reducing the appearance of wrinkles and other signs of aging.
Yeah. So, especially estrogen deficiency, it's one of the things that I tell ladies all the time. Do you feel like you've aged aesthetically rapidly since you become menopausal? And then nearly universally, they'll say, yeah, I felt like I was doing pretty good. And then I had my hot flash, and 2 years later, my face looks 10 years older. And that's because that estrogen has a major effect on our collagen elasticity. And so as that estrogen has gone longer and longer for females, they start to get more sagging and drapiness of the skin. And so it's another reason why a lot of times I'll diagnose females as early menopause. And maybe they're like, well, I'm not having hot flashes or vaginal dryness. Maybe we shouldn't treat it. And that's one of those I always talk about, like, we can treat now and preserve the skin. And that's nearly always the selling point. Like, okay, yeah, you got me. Let's protect the skin.
All right. So then we've got this one left and then one surprise one for Dr. Kris. We'll see if you can dance with that. So, all right. Reduced risk of cancer. Bioidentical hormones can help to reduce the risk of certain types of cancer, such as breast and ovarian.
Okay, so the second biggest thing that we hear negative about hormone replacement after heart issues is cancer risks. And so there's two long-term studies now. The last one came out in 2021, so about a year ago, that proved that so it's specific to pellets, but that's where the studies were done. Both studies had thousands of patients in it. Both came out with the same results. And by the way, breast cancer is the big topic because so many providers believe hormone replacement causes breast cancer. And so what they saw in this study when they used testosterone and or estradiol estrogen pellets in these patients is they saw a 40% reduction in breast cancer. Reduction. Okay. So they lowered breast cancer 40% in these patients. So when patients come in and tell me, am I raising my risk of breast cancer? I'm like, no, we're lowering your risk of breast cancer. Does that mean you can't get breast cancer? No, ma'am, it does not. But it means you're 40% less likely to get it than if you didn't do these pellets. So it's still important that they do their screenings and stay on top of all of that, of course. But yes, we absolutely are lowering chances of cancer with bioidentical hormone replacement.
Wow, this is really cool. So, all right. So you refer to a certain vitamin that should be, you would say it should be called a hormone, or you think it should be called hormone, not what's
Vitamin D.
That's right. Why do you say that?
Why do I say that?
Yeah.
Because we have hormone receptors for vitamin D from literally from our head to our toes. And so it's just like our hormone receptors that are on every organ system in our body. So basically, and it has so many different effects. It actually affects, like we've talked about here, our bone and joint system, but even more importantly, or as importantly, our immune system, and then our mood. And it just does so many things that it very much acts like a hormone more than a vitamin. But as I always joke, they're not going to rename it hormone D. So, but that's why most guys or girls, providers that do what I do, believe that you need to look at vitamin D as a hormone, not just a vitamin.
All right. Excellent. Great. So I think you're going to pass your boards without a problem.
If only that's what it was about, right? It's about the stuff that I don't do so much anymore, but we'll still knock it out. No problem. We'll get there.
No, you did great. That was excellent. I kind of like this process here with you. So if you're a woman and you've been hearing, and maybe you've questioned about bioidentical hormones, it's just a pellet. You're doing this under supervision with Dr. Kris. And what's the best way to kind of come in and get a check and see if this is a possible solution for them?
Let me say one more thing, and that is that it's practically a painless procedure. I think that when everybody hears a pellet, they all of a sudden start backtracking and thinking, oh my God, this on a scale of 1 to 10 is easily a 2 out of 10 procedure. And I've yet to ever, after thousands of pellet procedures, have ever had a patient, and I'm not a scout, but scout's honor, if I'm not telling the truth, they can kick me in the shin, is that I've never had anyone actually get the procedure and say, oh my God, that was worse than I thought it was. They always say, that's it. So it's actually a very painless procedure. But the easiest way to start it is we recommend just going to the website, theresearchclinic.com, hitting the consult button, putting in your information. Lauren, one of our Awesome employees will be the one that reaches out to you fairly quickly, usually within a few minutes, actually, if it's during business hours, or you're welcome to call 817-599-9902. Either way, you're welcome, but I think that the website is the easiest route to get to us.
Yeah, and if you're wanting to work with a physician, a provider that cares and is totally open to you asking whatever questions you need to ask, then Dr. Kris is your provider. And I think that's what most folks, we want to take ownership of our health, but we also need a provider that'll go with us and answer our questions. And that's what I really enjoy about Dr. Kris. Any last words, Dr. Kris?
No, just happy holidays to everyone, and hope you have a great rest of y'all's week.
All right, well, that's another excellent episode of the Dr. Kris Life Podcast, and that's a wrap. Thanks for joining the Dr. Kris Podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast.